you'd have to be living under a rock not to be hearing about the Zika virus. But the question is, should you be worried about it here stateside? Well, the World Health Organization has declared it an international health emergency. That's since the virus has been linked to birth defects. It's generally transmitted by mosquitoes, but the CDC has confirmed a single case popped up in Texas that was sexually transmitted. Now, here to explain what is going on is Dr. Richard Klein. He's an infectious disease specialist, and he's kind enough to join us. Doctor, as always, thank you for the time.
Thank you.
Okay, before we even get into the fears, some of the prognostications we've heard in different parts of the world of it, give an idea of what the Zika virus is beyond what people know, which is it's largely transmitted by mosquitoes. Talk about the impact on the body and also known therapies too.
Let me just have the impact in the United States and Canada, in North America, is practically zero. So everybody has to calm themselves. This is a South American epidemic of a viral infection, which is a very mild infection. Maybe 1 out of 5 people who get the disease actually feel a symptom. So it's a very mild disease, and it is really not going to affect North America. There's no mosquitoes in Canada that have this virus, and there are no mosquitoes actually in America that have in the United States that has the virus. So nobody's really going to get this disease except somebody rarely who's going to have sex with somebody who is infected who came from. But even if you get the disease, the impact on everybody except possibly pregnant women. Now, say possibly because there's a whole bunch of statistics that show that the amount of people that were claimed to be sick with the virus in Brazil is probably inflated by 4,000.
Now, for folks who may have heard the term microcephaly, it was, again, in Latin America and South America where there was a specific spike as to children that were born with smaller brains and heads and at birth. And there was a linkage, or at least a presumed linkage, maybe between the Zika virus and some of the consequences we see in the newborns.
Right. Actually, in the United States, there's no such bug. We have 4 million babies born every year. 2,500 of them are born with microcephaly. That is, their brain and their heads are small, and that leads to all sorts of birth defects. In Brazil, who have 3 million births a year, they were reporting like 150 people with this disease a year, microcephaly, not any disease related. And all of a sudden, we had a big increase in the infection rate of Zika virus, and the Brazilians got scared and thought that maybe other diseases would have other consequences, such as microcephaly. So they've always been known to have very poor reporting when it comes to medicine. They told every doctor every baby that's born with a small brain or a small head is to be reported. 4,000 people came up. It's a tremendous number. After they looked at those numbers, they found that probably 250 really had microcephaly, and they've only proven 6 so far that had this virus.
So when you hear things like in Salvador, they're telling women don't have children until 2018, well, it's complete overreaction.
It's overreaction and made worse by the CDC. Not made worse by the CDC, made worse by WHO, the World Health Organization, who were very sluggish in recognizing the outbreak that we had 2 years ago with Ebola, and was so highly criticized that they jumped on this thing so quickly. Now, there are some diseases that come after viruses, any kind of a virus, Guillain-Barré syndrome, microcephaly of children, of newborns, can possibly come from viruses, but the numbers are so overblown. CDC is playing their cards very low. They're saying that, well, something has to be done just so we could get the facts straight, because...
And you've spoken to some high-ranking folks in the last couple of days, and they've echoed that. You know, somebody said something to me earlier today, which I think is fair. Is there also a risk to this, whether it's the bird flu, Ebola, we can go up and down the line, that the public almost gets inured to it, oh, this is the latest thing that's coming out, and that when there really is a health crisis, there may be a little bit of crying wolf?
Yeah. Well, Ebola, everybody went crazy. I guess the media really sucked it to everybody. Everybody was really scared. And as I told you, 100,000 people die of the flu every year. Get patients to take the flu shot is very hard. If there were an Ebola vaccine, everybody in America would have taken it, and only one person died. So as a physician, we're very conservative. You have to be very careful. Somebody said there's so many factors going in, and most of the time CDC gets their information from newspapers, you know, and before they get in there and get the facts.
So take a collective breath, everyone, on Zika. Stateside, at least, you're going to hear more of it, I think, from what the Dr. Klein said is this is contained. It's not even on our shores in real sense. Doctor, I appreciate, as always, the time. We come back, everyone, we'll take a look at some local headlines. Stay with us.